Zambia Blog Talk Radio.
Are you ready to start your own show? Look no further than Zambia Blog Talk Radio TV's unbeatable hosting packages. We have hosting packages for all your live streaming needs. Introducing our basic, standard, and premium plans designed to fit your show's unique needs. With our basic plan, you get hosting and streaming only to Zambia Blog Talk Radio TV platforms, technical support, and a full hour of captivating content. Choose our standard plan, and you'll not only enjoy everything in the basic plan, but also receive promotions on our Facebook page and the freedom to stream to your personal platform, Facebook or YouTube. Your show, your choice. And for those who demand the best, our premium plan offers all the benefits of the basic and standard plans, plus the ability to multi-stream to your preferred platforms. That's right, the spotlight's on you. But wait, there's more. Are you planning an unforgettable event? Our events package is your ticket to flawless live streaming. From weddings to conferences, we make every moment count. Ready to shine on Zambia Blog Talk Radio TV. Reach out to us today at zbtr2009@gmail.com for questions, inquiries, or to create a custom one-time show package. Remember, at Zambia Blog Talk Radio TV, your success is our mission. All fees are subject to periodic review and change, ensuring you always get the best value. So, what are you waiting for? Let's make your show a sensation only on Zambia Blog Talk Radio TV. Zambia Blog Talk Radio TV, where vision comes to life. Follow our Facebook page at www.facebook.com/Zambia Blog Radio or visit our website at www.zbtr2009.wixsite.com/ZBTR-TV. Don't miss this opportunity to shine on ZBTR TV, where your vision comes to life.
Hello, everybody. Merry Christmas. Happy holidays. Whichever you prefer, everything goes here. Welcome to the show. It's December the 2nd. Believe it or not, we are already in December, and I hope you are ready for this time of the year. That's the reason we are here this morning, is to talk about things to do with the holiday season. Tell a friend, ZBTR TV is live, and we are here to reach out to you and to communicate things that matter. Follow us on Facebook, Zambia Blog Talk Radio, and YouTube. You can subscribe to our channel, ZBTR TV. All right, so today we have an interesting discussion. First, let me welcome another gentleman who is not a stranger to this platform. He shows up whenever he wants. Morning, Pastor Alan. How are you?
Good morning. Thank you so much for having me.
The people are asking me, where has he been? Where has he been?
Well, yeah, you know how it is. When we came to this nation, we did not read the small print. We heard of the milk and honey. So we didn't read the fine print.
That's interesting. Family doing okay? Merry Christmas to you.
Yes,
happy holidays. Oh, in Zambia, I forgot one. In Zambia, they say compliments of the season.
Yes, compliments of the season.
That's a good one. That's a good one. So, everybody, we have this is a touchy subject, and it cuts across board, and it affects it somehow. In some way, it touches you in a way that all of us are affected. I can't even find the words I'm looking for, but we shall get into it. Today, we greatly honored, and Pastor Alan is responsible for what is going to happen here today. We greatly honored. Yeah, we're greatly honored to have Mutinta Tembo. She is the founder of Awesome Mind Psychiatry. Oh my goodness, I just like that title, Awesome Minds. Mutinta, good morning, welcome.
Thank you so much. Thank you so much, my brother. Good to see you. Good to talk to you again. Hi, Mr. Mlenga. And for sure, you have a responsibility here, a huge one, because you dragged me to Mr. Nathan, and I am so grateful for that. I'm here. I'm so happy to be here today.
Excellent. We're looking forward to having an interesting, a healing, a therapeutic discussion, so that everybody concerned and everybody out there who doesn't seem to want to even think about celebrating this holiday season, to help them to say, look, it's all right to do it, but we'll let Ms. Mutinta deal with that. You know something, I pay attention to things that I see and which come my way. And so I was looking at your names. I'm like, Mutinta Tembo. That's an interesting combination, right?
It is. It's a mouthful.
A mouthful.
It's a mouthful to say the least. So yes, Mutinta Tembo. I'm proud of it, though. Okay. I am a good mix of the East and the South. On my mom's side, I am from Hamangaba. I actually grew up there, just east of Nalutanda, and and to the east we have Moya, and I think we have a president that grew up there, right, in Moya Wengwa constituency. So that's where I grew up. I grew up with my grandmother, and went to Njase Girls. And my dad is from Chief Ndake village, Sichivende in Nyimba.
Wow. So, that's a good one. She's a true Zambian, Alan, eh?
That's a true Zambian, you know?
Pure breed. That's great to know. I'm sure Dr. Munsanja is saying, oh, okay. Tinta, you've been a nurse for many years. Why mental health practitioner track? Could you also help us understand what family psychiatrist entails?
Absolutely. That's a great question. So, I mean, I think sometimes we come here and we have ideas of what we want to do, and then reality hits us, right? And like, Pastor Nathan said, we don't read the fine print until we get here. And initially I was doing accounting, and I worked at the health department where, in accounting, we are busy towards the end of the month. And then after that, we were free. So I would go in the front office to help the senior clerks. They were doing eligibility for the week program. Yes. And the director there, who was a doctor, would watch me and how I would interact with the clients. Mostly these are clients from low income. I still treated them with respect. And most of the times when when it comes to low income, this is where mental illnesses are prevalent. Most of the times they have no access, to those services. I looked over that, and I still saw the person that was in front of me. And as she continued to watch me interact with the clients, she was like, why don't you get into the healthcare industry? You could make a good nurse. And I was like, I could, So she planted a bag. She was like, okay, yeah, if you're interested, I'll give you a referral letter. And I started to look into it. And I went into nursing not knowing exactly what my specialty would be. And I went there with a mind of curiosity. And at some point, I'm like, I could do dermatology. I like fashion. I like beauty. And I can do this. I can go home. I don't think they do that back home, So all these thoughts were going through my head. But when we got to the clinicals and we started going into different settings, psych spoke to me. Initially, it was a hospital that was set up, I would say, like Chinama.
Yes.
Those are the kind of patients that I saw. A lot of schizophrenia, bipolar 1, very altered reality. Like you can see that there is internal stimuli, right? They are talking to someone that you can't see. So really serious mental illnesses. And that was the first time I was in that kind of setting, because I had never been to Chinama. So already my curiosity was picking up. And when I got to practice, I intentionally started to gravitate towards psych.
Okay.
I wanted to experience different settings of psych, both in the hospital, and I went to work in private care, high-end private care, which is open door, very opposite of where I had trained from. And I saw executives there, people who ran big institutions, and they were seeking treatment. And they had relapse because they didn't take their medication. And I'm looking at their diagnoses. They're serious mental illnesses. And I realized that at that point that we lack that service back home. Like, where in Zambia can I go if I'm in between Chainama and the community?
Yes.
There was a gap there. Where do normal people go? What if they're depressed? What if they have anxiety? Who is treating them? So I very quickly realized there was a gap, and I became more curious. And around that time, one of my cousins, I actually dedicate my presence today to her. Her name was Spencer. She was walking to the shop with my mother. She owned a shop at Town Center years back. And someone who's believed, I would like to think they had schizophrenia. Back home we say wofunta, right? Which I don't like to use because of the stigma. And he picked a brick and hit my cousin in the head, and my cousin didn't survive. So there was some kind of trauma associated to it. I felt like I could do something. I wanted to understand. It was curiosity. It was interest. It was fascinating to me. And that's what led me into getting into psychiatry. I wanted to understand psychiatry in its entirety. So I didn't want to specialize like children, adults. I wanted to do the entire thing. And that's why it's family psychiatric. So psychiatrists are MDs. I am not an MD. I have a master's in psychiatry. So we are referred as psychiatric providers.
Okay. Excellent. Okay. So the reason we are here today, Mutinta, is people go through a lot of difficult situations in life. Okay. The list is long. Loss of a family member, parent, grandparents, child, a sibling, death of a co-worker, and they may not necessarily have died during this time we are in. For those of us in America, from Thanksgiving going through to the Christmas period into New Year's, it seems to be like the memories of these situations particularly become a challenge during what this period we call holiday season. Why is that so?
Well, first of all, there's an obvious void. There's an obvious void. If it's a family member, if it was a dad in this American culture, were they the ones, if we fry the turkey outside, were they the ones going to get the charcoal, prepare the dinner? Did they carve the turkey in the American culture? The dad or head of house carves the turkey. There's a void there. So those memories are kind of inevitable. I can talk of my own experiences. My sister, her favorite holiday, whom we lost a year ago, her favorite holiday was Christmas. She would stay up. She wanted to be up at midnight and tell everyone Merry Christmas. The first text that I got or message that I got on Christmas was always from her, because she would wait for the minute. My beautiful sister, Merry Christmas. And last Christmas, I looked for that text.
And it wasn't there.
It wasn't there. So inevitably, we will have those memories because there's a void. And that's the void that we try to cope with. Yeah.
Yeah, well, Mutinta, obviously, and speaking as a community leader, since I got so deep involved in the community, we deal and we see so many different scenarios. Obviously, one of the things that we deal with is it's the issue of loss, for instance. That's one of the big ones that You're out here, and your parents or your sibling or those that have left children, they pass and they're back home in Zambia. How do I even grieve? And then when you look at the people here, the typical Americans, if you're surrounded by the Americans, the way they grieve is totally different from the way that we grieve. Someone's parent could have died today. To relieve their stress, they go off to Busch Gardens. Whereas for us, that's like, hey, you're the one that killed that person. How are you in a place of enjoying something when your mother just died or your sibling just died? So how do what tools do we have to cope with that? Because we see those so many times in our community.
I mean, grief is different for everyone. Even within the American society, it's not going to look the same with every person. And it's important to understand that. Even within the culture, we're going to grieve at our own time. It's not going to be synchronized. There are different cultures, and I think it will be a loss if we lose our cultures. I think it's important to mourn how we know how. Let's not lose that. I've actually seen research where it's actually maladaptive to sweep that under the rag. Have you really gone through the 5 stages of grief? Because the initial one is denial, right?
Yeah.
As a provider, I'm thinking, are we in denial? Has reality sunk that this has occurred? Okay. And so you can't look at the other person, oh, they go to Busch Gardens. Well, you don't know if they are maladaptively coping. It may not have sunk. After they go to Busch Garden, when they come home, probably their next reaction will be anger, because that's the next one, right? In the series of grief. And you're not there to see the anger. They're at home. They're questioning God now because reality has sunk. They can't escape it. They can sweep it under the rug. God, why me? Why is this happening? They'll be angry. They'll be angry probably at the person that has passed. If they ate well, they wouldn't have had a stroke. If they were not a womanizer, they wouldn't have gotten that disease. If they took their insulin, they wouldn't have died. And sometimes you blame yourself. They may blame themselves. I should have done more. I should have sent money so that they went and saw a doctor. So you can't look at the next person and say, oh, they're coping like that. No, let's grieve the best way that we know how. And if this is how we grieve in our community, we can. And I know we have to earn a living and sometimes kind of have to put those feelings aside and go work. But in our own spaces, let's continue to process. Let's feel. Most of the times we feel like the appropriate way of grieving is, let's be strong and, let's not stay in the place of pain. That's inappropriate. Let's feel. The more we feel, it'll pass through our bodies, and we continue in the process of grieving until we get to a place where we accept the loss. Just because we may accept it a year later, and just because we accept it, it doesn't mean that the pain is gone.
The challenge, Alan, if I may throw in a follow-up question there, Mutinta, is you've made a statement here, mourn how we know how. I think that the challenge in our community comes with us, though the other people, how we relate with the person grieving. I think that's one of the challenges. So how do I walk along? How do I grieve along? How do I try to be in that space with this person who's mourning and try to help them mourn how best they know how to mourn and how they need to mourn? I hope that came out right.
No. That is actually perfect. That's a great question. So I feel like we can't assist our loved ones if we don't understand where they are in their mourning process. So if we are going to be there, let's try and understand where are they. So in my profession, we are blessed to have, theorists like Elizabeth Kubler-Ross, right? And that laid out stages of grieving. So understanding where they are. So first thing, we want to assess, how are you? How are you? How are you feeling? How are things? Find out how they are processing. You will know if they're, blaming, I shouldn't have done that. They may be bargaining or still angry, because the first one is denial. The second is anger. Then they start to bargain, God, please take away this pain. If you just take it away, I'll go to church. They are trying to regain control. It's so overwhelming, the pain. So in the process of trying to gain control, they start bargaining. So you will hear from the way they are talking. They may be in depression, they look sad, no smile, flat affect. You can see they're sad. They're not taking care of themselves. They are not sleeping. I'm not sleeping. My heart is racing. It's all the time. I feel sweaty. I can't eat. I'm not sleeping. You know that they are depressed. So knowing where they are, then you will know how to assist them.
Pastor Nathan, first of all, I told myself that, hey, you're part of the host. I'm not going to insert myself. It brought up so many emotions for me, just this little talk, because I think Mutinta mentioned when my mom passed, I had just arrived here. And this is more than 15 years later. I've been to Zambia in this year, 3 times, and I have not gotten myself to go to the gravesite. And earlier on,
why?
You mentioned
Why?
Well, and that's where it is. She mentioned sweeping it under the rag. My reason has been just pretend it's something that I don't need to do, or it's not there.
Okay, let me interrupt you, Pastor Alan. Okay, Mutinta just addressed that. He hasn't gotten himself to visit mom's gravesite. There are people watching here and they've probably done the same thing. So let's address that before you build it on further, Alan.
Okay, so the 2 important things he mentioned there is sweeping it under the rug. It's too painful, and the body cannot process it. The easiest thing to do is to sweep it under the rug. And I hate to say, that's denial. That's denial. Is denying that she's no longer here, because the reality of not ever being able to hug her, not ever being to tell her you love her, not meeting your children, probably your grandchildren, that is too painful to bear. That's too painful to bear. So the best way, sometimes the body knows what to do. Denial is meant to protect us. It's a coping mechanism, because the body is realizing that you are in shock. And that pain is too much. So we just go in denial phase. So I have to point out that's a maladaptive behavior. In America, they say you're kicking the can down the road, right? It's inevitable. At some point, we'll have to deal with it. So we are just prolonging the inevitable.
How do those of us around Alan, his wife, his kids, those of us, his friends, how do we help him?
That's a great question. So what I heard him say, by the way, I'm so sorry, Pastor Alan. I am truly sorry. And I think I would like to think most of us have experienced loss, but it's very unique for everyone because there are so many factors that are involved. So when you talk about 5 years and he hasn't,
Well, actually more than 15 years.
it was 5 years, or it was 5 years after you had gotten here, so 15 years.
Yeah, no, actually, I got here within that first month when we got here. She passed, and I just spoken to her like on a Thursday, and I was supposed to talk to her on a Saturday, and I didn't. That's the day she passed, and I only found out they were already at the graveside on a Tuesday, or Tuesday where they were burying when I called, and they were already at the graveside burying. So,
Now that is that's what we call complicated grief, right? And normal, and usually I try to avoid using terms like normal, abnormal, but in this case, normal grieving, the grieving process, like denial, is short in nature. It's meant to be short, just that initial startle, initial shock, and then we get to anger and going down the list of the process, right? So when it's been 15 years, you know that's complicated grief. Most times, even at the church, we are facilitating adaptation of normal grief. When it's complicated, this is when we want to help Pastor Alan, my brother, talk to me so I can refer you to therapy, because we need a therapist to use specific tools to deal with their trauma. At this point, it is trauma. And I can see from the way you are reacting, the kind of emotion is bringing probably flashbacks. You probably have nightmares. I don't know that. But the therapist will be able to establish those things. And they have techniques such as cognitive behavioral therapy. Identifying the negative emotions that you're going through, because those negative emotions, those are the ones that are pushing you towards sweeping that under the rug. So identifying them, and it's under the premise that once we understand those negative emotions, we can begin to replace them with positive emotions. That's called mind framing, mind structuring, And the therapist will help you work through you getting out of that denial phase. It'll be complex. You may have to deal with the anger, the bargaining, and you've probably gone through that, but you've gotten stuck in the first stage of grief. So advice here, you're my brother. I think let's go to therapy, and I have a good one that can start to work with you and go through that process.
I don't know what you want to, how you want to respond to this, Pastor Alan. Let me throw in a question once you're processing.
Yeah.
So now I know, as a family member, as a friend, as a community member, like you said, knowing where the person is in their grieving. Okay. Now I know where Alan is in the process. Now I know where Priska is. Let me put up the comment here. She says, I can relate to Pastor Mlenga. So now I know where Priska is in a grieving process. Okay. Now Alan knows where I am in my grieving process. How do we, what's the word? How do we help them? You've already said therapy. Okay, that's of course that level. So now how can we help him as a community, as friends, as close friends, relate to him or to Priska?
Okay, so when we kind of, disclose, what she did is just disclosing her own emotions, her own traumas, so to say, or her own grief. So there's power in universality, right? Because now she's not alone. There's power in that. And we need to start talking to one another and relate, disclose. And sometimes, she can relate. I'm not sure whether she's at the denial phase. She may be at a different phase. Mm-hmm. And if she's at a different phase and she's maybe at acceptance, then Pastor Alan can start to say, how did you get to acceptance? And then Priska can share, this is the process I had to go through. My brother, maybe, our mother, that was our time. Whatever she coped with, whether it's God, what God had to acceptance. It doesn't mean the grieving process is done once you get to acceptance. It's still ongoing. Mm-hmm. You're just at a different stage. So we share. And sometimes as family members, when we're not professionals, not even professionals, sometimes we just don't know what to say when it's that profound kind of pain.
Yeah.
Okay?
Yeah.
Just be there. Yeah. Just listen. Listen. You may not know what to say, just listen. How about holding their hand? Check on them, see how they are doing. I'll give you an example. As I was preparing to come here, I've gone through, loss as well. I've been here for a long time. Obviously, I've lost loved ones. And I wanted to talk to some family members and see how they felt about disclosure. Mm-hmm. And I'm not going to touch on how they felt out of respect. And they told me how they felt about disclosing. And then I asked, how are you? And I realized I made a mistake because I asked how they were after asking for their opinion. If I had asked how they were, I would have known that disclosing was a non-starter because I feel like they are doing well because they still imagine their loved one is still present. Mm-hmm. So I realized that I would have known. I would have known. So really, it's just understanding where everyone is and be there the best way that you can. And sometimes the person that's grieving will give you an idea of what they need out of you. Some of them may just need your company to be there. And if you're noticing that they're not, let's say they're bargaining with the guy, or they're despairing at the bargaining phase, or even at the depression phase, that's when the suicide ideations start to come in, right? Under depression, they're not motivated. They don't want to go to work because they don't feel energetic. They're not eating. They're not sleeping, and all of these things. And then they start to entertain ideas of, if I didn't wake up, I'll be fine. What's the purpose of being here? And as family members and friends, then we can start to encourage them. Like, really, after acceptance, there's a whole life. You don't have to forget the trauma will never go away. The grief will never go away. What we do is we learn how to live with the trauma and the grief, while we are also living our lives and growing, and hopefully we get to a joyous space. So instill hope in them that they can still get there. Look around and try to talk about grace and gratitude, being grateful about what they have. We have all the basic needs. We have shelter. Look at where God has brought us. It's important to, I think, consider religion. What is it that instills hope in them? This is your arena. In your situation, how do you instill hope and get them out of grief?
The what do you call it? The leader, the minister now is the one that needs to receive hope. And I like that you throwing that question or that challenge, if I may use that word, to Alan and I. We are community leaders here. A lot of people on this forum here, when I look at the list of names, these are community leaders: Brenda, Winnie, Priska, Nelly, Clotilda, and everybody else I can't make, Richard. All these are community leaders, and we are dealing with things. Okay? Clotilda says, Pastor Alan, I have also avoided going to my father's grave. He passed away 5 days after I left you.
See,
I,
yeah.
I don't know whether I should say this. She's my sister. She can beat me up if she wants. This is a community leader, Mutinta.
Yeah.
People look up to her. And she has these underlying things going on. And that's everybody. That's the reason we are here. This can be a very difficult time of the year. I was telling Mutinta, everybody, remember what I said to you? When my mom died, I didn't sleep for 3 days. And I opened up to her about some things, and it's only when you talk about it, that's when you realize where you are in this process and in this situation.
Yeah.
Let's take a break here before we continue our conversation. Winnie is having our annual, the 6th annual fundraising gala next week on Saturday. If you wish to participate or to attend, you may not be able to go, but even you can donate. She helps. Yesterday was International AIDS Day. Is that what they call it? World AIDS Day. And that's what Winnie Musonda Hope Foundation is about. She helps people, orphans, kids who've been victims of the AIDS pandemic. That's the number there. If you wish to call Winnie and find out, you may want to go and attend the event. You may just wish to make a donation of the same amount for the event, $145. So I want to encourage everybody, let's participate. Winnie is part of our community and she's doing a great job. Our guest this morning is Mutinta Tembo. She's, how did you say it? She's a family psychiatric.
Yes,
Okay.
family psychiatric practitioner. Yes,
Family psychiatric practitioner. We need to be very careful with this terminology because we don't want her to receive an email from the certification board to say you were at some platform and you claimed the A, B, C, D, blah, blah, blah. Everybody watching, there's a lot of things to unpack here. And both Alan and Mutinta have agreed that we'll have a continuation of this discussion on the 16th, not next week. Next week, I wish we could do it next week, but I have Pilato already scheduled and he's agreed to come on the show. He's going to talk about transitioning from being an activist to being a government official. So that's going to be my discussion next week. But Mutinta and Pastor Alan will come back on the 16th. How do you deal with people who say they don't want to celebrate Christmas? They can't. They just can't. You have given a perfect example where you used to get a text message from your late sister. You could have also taken that position to say, I know somebody personally who tells me they can't celebrate Christmas because that was their brother's favorite holiday. How do we deal with people like that? How do we help?
Okay. So, I mean, I'm not sure where they're coming from. I obviously I don't have the details. Most of the times, it's guilt. Remember that third stage of grieving. We feel guilt. They're gone, and we are here, and we are supposed to celebrate what? Christmas. Therefore, we feel guilt. And
that what's the guilt? That if I celebrate,
we are still here, and they're not here to celebrate it. They are gone. You know, there's just so guilt. Survivors is a real thing, and we also we don't want to give ourselves permission to be joyous because we're supposed to be sorrowful.
Alan, did you hear that?
Yeah. Yeah.
We
You know
don't
what?
want to give ourselves permission to be joyous.
Yes.
Wow.
Yes.
Mhm.
And as a community leader and leader in the church and everything, that I find, one thing that I do is I go after anyone that's hurting and go help them
Mm.
and not deal with, I'd rather be at somebody else's funeral. I don't want a big deal about my birthday. It's great, and sometimes you do it. Okay, you've got kids, you got a wife. Okay, yeah, you accept it. But if it's up to me, I'd rather be out there helping somebody else.
Mhm.
So
Right. Yeah.
especially in our community, when you're a guy, you're told to be strong. When you're a pastor,
Mhm. Mhm.
especially in
Mhm.
the pastor you pastored in Zambia, you have zero weakness. Doesn't
Mhm.
matter what's going on, you have zero weakness. Even if you don't
Mhm.
have transport money, kukutura fea chipanga, don't tell nobody that you ain't got no money, because you are
Yeah.
the man of faith and
Mhm.
everything. So yeah.
Mhm. Absolutely. I mean, there are social factors or cultural factors that will affect how we process and how we grieve. I think being here, even here, there are people who believe that a man is supposed to behave in a certain way, and I truly believe that's very toxic masculinity. Men feel too, you know. You are someone's son, and we are born with this innate love with us, you know.
Mm.
So when that mom is not there, where does this innate love go? You know, we're supposed to mourn, you're supposed to feel. So as far as that's an interesting question, and I'm glad you asked, how did I deal? It was an interesting time because she passed like 2 months before Christmas, and I actually lost two sisters in 29 days. So
Oh,
I was
wow.
just like so overwhelmed. What made it complicated is it had just been 2 years after my children's dad had died. So
Wow.
my children were still mourning their father. It had been 2 years, and they are wanting to celebrate Christmas because this is huge. This is their culture. They're Americans, and they expect us to have Christmas. And I'm the mom. We're supposed to have a tree, and they want to feel joyous. But here I am mourning two sisters who had just passed 2 months prior, and I had to balance that. I had to recognize where my kids were in the grieving
Mm.
process, that they were getting to a point of acceptance, knowing that, yeah, their dad is not here, but they can still continue to grow, they can continue to be hopeful, and they can continue to be joyous during Christmas time. And
Mm.
I struggled. Obviously, that was the first Christmas for my sister. It had just been. So personally, what I did, I incorporated something with their culture to honor
Mm.
my sisters. We do collect ornaments, so I wanted to represent my sister. Each ornament means something. And both of my sisters, they were different. One was flamboyant and, big hair, statement. The outfits will speak for. The other one was calm and very religious, and the one who would text me. So I wanted to honor both my sisters in my children's celebration of Christmas, even though I didn't want to. I will not lie. If I said I was looking forward to Christmas, I wasn't.
Mm.
I wasn't looking forward to it because I was hurting, you know. Um, and we got ornaments, we got birds. They're gorgeous birds. Here they release, doves when someone passes to release their spirit. So I incorporated my children's culture, American culture, and we got ornaments. And I picked my sister's personalities. One was flamboyant with gold, and the other one was elegant with red. And we decided to have a moment where we put those ornaments, acknowledging my sisters in my children is celebrating of Christmas. Even though I was hurting, I was able to join them,
Mm.
also honor my sisters. But you have to balance, and I was glad that my children understood that I was still in that bargaining and anger phase. I would oscillate, I would just go because grief is not linear. You're not going to go in through those stages. It can go back. You can get to acceptance today and still go back to bargaining, and I talk to them. I let them understand that, this is where I am in my grieving, but I want to support you in celebrating Christmas. And I don't want to be guilt. I don't want to feel bad to try to be hopeful and hopefully one day feel joyous,
Yeah, because there is a tendency for us to say, no Christmas here, fear Christmas takuli up.
Because
because of that's very helpful. Mary says, I've learned to cope with the grief of my father's loss by replacing the void of his absence with the beautiful memories shared. And Priska says this conversation is therapeutic. Dr. Munsanje, when I mentioned at the beginning of the show, the way I honor my family, departed young brother who died in London, June 7th, 1993, without life insurance. I'm an advocate of life insurance because of that. We brought him home for burial in Macha. Clotilda, sorry for your loss, Mutinta. I lost 2 siblings in less than 2 months apart. It changed my whole family dynamics. Ended up with my parents separating. There was so much pain in the family. One of the things I mentioned to you, Mutinta, was this component of blame. Blame sharing or taking blame. And remember, I mentioned to you that I lost 2, like Clotilda said. I lost my uncle who was like a brother. You know those uncles who are like your brother. I lost my uncle who was like a brother, and my friend who was my best man on the wedding. I think a few days apart each other. And at times when I go back, I don't know whether I've really processed that very well, or I don't even know where I am with that. And what I wanted us to deal with, probably as we conclude this first phase or session of this conversation, we shall continue on the 16th. There is that component of blame. If you've addressed it, but I want us to talk about it because especially us being out here, like you mentioned, if I'd sent the money in Dalama Shamuti in time, probably it wouldn't have happened. If I'd done this, and here's something else, Alan, isn't it always that the day you don't do what you normally do, that's when the loss happens.
Yes.
You talked about when you were supposed to, is it call mom? And
call mom.
I always, the day I didn't call mom, Mutinta, that's the day she died.
See that? Even just feeling that if I was still in Zambia, she wouldn't have died.
Yes.
Like I could have done something.
I'm talking about this blame thing.
Absolutely. And unfortunately, it's really part of the grieving process. Like I said, not everyone goes through all the 5 stages of grief. Some of them will skip certain, they'll have 2 or, and oscillate back and forth. But most of us do. And I think for me, I grieve so much the bargaining part, because that's when the what if. I say, what if, what if I had them transferred to, a better hospital that had, better skills or whatever. What if, I called my mom that day. She sent me a message. We just went, I didn't even get the gravity of it. I got the message the same day, and I called, what's going on? Oh, she's in the hospital. And 2 hours later, she had gone. I did not talk to her because I didn't get the gravity of the situation. So I keep going, why didn't I talk to her? Why didn't I video? I could have said something. I could have said, I love you. You know, what's going on? Maybe if I had seen her face, because I am a provider, you know, I could have seen her face. I could have not made, was she anemic? You know, it was blood sugar. Did they check your blood sugar? Did they give you something, you know, to manage it? Do you need insulin? Do we need to follow? So it's if, what if I talked to her?
Yeah.
We personalize it. And personalizing, making it as if it was our fault. Why do we do it? It's because we are trying to control the pain that we are feeling somewhat to manage it. And then bargaining with God, God, please forgive. If I just did that, you know. So it's a confusion.
Blaming God.
Absolutely.
Mm.
Absolutely. You start blaming God. Like, God, why me? You know, there are other people who do this. I'm a good person. I do this in the society. I've helped. Why me? Why God? You can even blame the people that have left us. You can blame yourself. You can blame anybody. It's just trying to cope with the amount of pain that you're going through. It's maladaptive. I think that's the most important thing. It's maladaptive. It's not healthy, you know. And how do we help people? That's a what if. Like me, you know, you can't change it. You can't change what has occurred. So if we dwell and continue to what if, it's not going to change anything. It's just going to perpetuate the pain that we are feeling, you know. And that family member that I talked to the other day, you know, trying to see where they were and how they felt, and they said, everyone has their day. You know, this thing called is inevitable, even though we'll never get used to it. Never, ever get used. No matter how much we experience it, we don't get used to it. And everyone has their day. So it's just maladaptive to try to blame yourself because you didn't do such a thing. You know, you don't know. There were probably other factors that you couldn't have helped, you know. So I think the most important thing to remember is that is a maladaptive behavior. It's just meant to help us cope in our own confusion. We are dealing with the turbulence of emotions. So maladaptively, we start to blame ourselves, or we blame God. It makes the pain a little less. You know, God, why did it? Or if someone why did that happen? We are trying to, you know, to deal with it the best way that we can. Is it the best way? Absolutely not. It is maladaptive.
Could that be the same reason? Like back home, they'll always blame somebody has killed them. There's got to be a witch doctor somewhere. It's never natural death.
That's where that comes from, right, Mutinta?
Yeah, absolutely. And I mean it to show up in different ways. But the bottom line is we are just bargaining. We are trying to ease the pain that we are going through.
Okay. A lot of stuff to unpack here. We haven't even gone to the part of available resources, where you can get help, the processes, how you can. Friends, everybody watching, let's learn to let's learn to get help. Okay, let's learn to get help. We have a few minutes here remaining. There's this big elephant in the house. Okay, if we don't exhaust it, we shall get to it. There's a tendency amongst especially us who call ourselves Christians, okay, to stigmatize. And I'm glad Pastor Clarissa is here as I'm speaking on this one. There is a tendency for us in the Christian faith to be stigmatized. When you seek professional help, it's a reflection of lack of faith.
Yeah.
Where do you draw the line between the two? So let me give this example. I prefer to talk about things with, first of all, by it's a personal family situation, but it's okay. When our youngest daughter was born, she was born with a heart condition. And the doctors told us that she needed heart surgery. And the man of faith that I am, I didn't want that. I said no. And the doctor said, oh, well, you know how things are here. They can't force you until you put a signature on that line and say yes. We went through that. Friends, listen to me. Benny Hinn came into town. I went to the Benny Hinn crusade, took the baby there, and I believed God. And in all that process, all I can tell you is that at the end of the day, we went through the surgery. This young girl, and when the doctors did the surgery, they said they've never seen anything like that before, where the catheter that they had infused in there synchronized with the natural parts of the heart or the body, like it was just, I hope I said that right. Medical terminology is here. So the point I'm trying to make here is that the question here is, we've even run out of time. I start such a huge subject and then the time is gone. So try to deal with it in the few minutes that you can. Try to address that. So where do you draw the line?
I mean, I think I'll let Pastor Alan talk on the religious part of it. I think the most important thing you say, already there was a miracle in how the catheter meshed, you know, with the cardiac issue. So I mean, I'm a believer of a higher power, a higher being, right? So there was a combination of help, Western medicine, with the power of God. Can't we have both?
Yeah.
Can we not have both? And what is wrong with that? Okay, I think that's my say on that. In the we'll expand next time. And what's your take, Pastor?
Now, before Alan comes in, if those of you would like to get in touch with Mutinta, go to that website and type in her name, right?
Yes.
Type in her name and the information will come up. You can reach out to her and she can help you. It's not for free. No, I need to mention that.
They can also go to the website, first of all, to get a lot of information on the disorders that I treat. Is mostly psych disorders, depression, anxiety, schizophrenia, bipolar. And if you go to DocSoc, you will look at what the other patients that I've treated say. So you get an idea of the services that we offer. But the list is very comprehensive on the website. So
did I put it right? ZocDoc, is that right?
Yeah, DocSoc.com is a third-party platform, but my website will be the most appropriate, and you get a full concept of what we do. And
we'll put up the website next time. Alan,
all I can say is that even this subject, if you look at the roots, it started with the church people figuring out how to help church people, and then it became what it is today. So for now, that's all we can say.
Right?
Yeah. But,
okay, everybody, please, if you have any questions for Mutinta, prepare them for the next conversation. We shall try to address whatever other issues she is going to raise. And we do appreciate everybody participating. Mutinta, thank you. Looking forward to having you back on the 16th. Please bear that in mind and look at our social media pages. And Alan, thank you. Everybody, as we go away, a big shout out to my wonderful, amazing sister, Priska. Happy birthday. Happy birthday. We shall see you all next week. And remember, next week, I'm talking to Pilato. Bye-bye.
Zambia Blog Talk Radio.